MRI case report. There is an expansive extra-axial lesion in the anterior interhemispheric fissure. It is hyperintense in T2-weighted MRI and flare, ISO to hypointense in T1-weighted MRI, calcified in SWI with intense homogeneous post-contrast enhancement. MRI findings are in keeping with meningioma. Meningioma is the most common type of primary brain tumor. These tumors originate in the meninges, which are the outer three layers of tissue between the skull and the brain that cover and protect the brain just under the skull. Meningiomas grow out of the middle layer of the meninges called the arachnoid. Types of meningioma. Convexity meningioma grows on the surface of the brain directly under the skull. Falcine and parasagittal meningioma forms in or next to the falx, a very thin layer of tissue between the two sides of the brain. Intraventricular meningioma forms within the ventricular system. An intraventricular meningioma may cause a blockage of CSF flow, leading to hydrocephalus. Skull base meningioma grows in the bones that form the bottom of the skull and in the bony ridge in the back of the eyes. Sphenoid wing meningioma forms on the skull base behind the eyes. Example is a meningiomas arising from sphenoid wing. Olfactory groove meningioma forms along the nerves that run between the brain and the nose, cause a loss of smell, and can grow large enough to cause problems with vision. Posterior fossa petrous meningioma forms on the underside of the brain. It can press on the cranial nerves, causing facial and hearing problems. Petrous meningiomas can press on the trigeminal nerve, causing a condition called trigeminal neuralgia. Suprasellar meningioma arises from the base of the skull near the pituitary gland and the optic nerve. Tumors in this area can cause visual problems and dysfunction of the pituitary gland. Recurrent meningioma. Any meningioma may come back. It may be the same grade or a more aggressive or malignant form.